to look at it is instead of those 4 quadrants, which are very important, into 2 categories: urgency and convenience. And so every patient that walks in the door, my first thing is, and I teach doctors the same thing, you have to emphasize the urgency. So if you see a patient has a cavity and most cavities are not hurting you, doctors will say, hey, you have a cavity here. When would you like to schedule? And that phrase doesn't emphasize any urgency. And so it's a verbiage. Verbiage is huge in dentistry. It's how do you change that verbiage into where you now are not giving that option to schedule because you're not creating urgency with that, but how do you create urgency with it? So changing it up to, hey, Mr. Smith, you have a cavity here. I don't want it to get worse. We actually have time to do it today. Would you like to do it today or would you prefer tomorrow? Now, I'm not giving them the option of when would you like to in general. I'm giving them options of, hey, you're doing it or you're doing it. The concept of 2 yeses, so to speak. Convenience, I actually call my cavities, and this is a tip for all doctors. I call cavities by time. And so I call it a 1-minute cavity, a 5-minute cavity, a 10-minute cavity, or a 2.5-hour root canal. And I purposely choose those timings because, for one, that's how long it'll take for most doctors. And 2, it allows a patient to learn the convenience. So when you say a 5-minute cavity to a patient, they're thinking, well, I've already taken off of work. He just said 5 minutes. I'm more likely to do it today. And so that convenience really goes into it because most people don't want to come to the dental office multiple times. They want to get in there and get what they need to get out and not take away from family or work. And so emphasizing the 2 things really helps patients say yes. Education, I think using a tool to show the patient, we're in 2024 with technology. You patients should be able to see what you're looking at. If you're not using technology, I think you're not doing the best service because now patients are just having to trust what you're saying. And case acceptance increases dramatically if you can show them why you're saying that.